Many of you already know our next speakers. They are the FA Cancer Awareness Team, or CAT. Christine Krieg and Eunike Velleuer Carlberg will now be giving a talk on oral screening, cancer awareness and self-empowerment for cancer prevention in FA. You'll also have an opportunity to meet them and the entire oral screening cancer team from Germany at the Oral Screening Party Lounge on Friday evening, right after the banquet. Thank you.
So this is a brand new t-shirt. It's limited edition.
How much?
Our team, please stand up. And tonight we have the game Beat the Expert, and the winner gets one of the cat t-shirts.
Yeah.
Let's jump in. So who is new in the room? Who was never at an adult meeting or something like that? There are quite a few fingers. So my name is Christine and I'm a Fanconi mother. Our son Lucas deceased at age 19 due to oral cancer, and this will be the 10th year without him this year. So it's a long time ago somehow, but still it was just yesterday. And and I got back into the Fanconi topic again due to the project, which I was supporting by funding before all these years. Eunike and also Ralf Dietrich, who a lot of you know, they asked me to step into the project. The project will turn 20 years next year. Can you imagine? A long, long years. Phase number 1 and 2. We had scientific questions. In phase number 1, it was about, does oral brush biopsy work in Fanconi anemia as an early detection of, let's say, weird cells, not only cancer cells. So it's not our topic to look for cancer. We are in the topics of prevention, which means we want to find cancer find cells early before they become cancer. So in 2020 we published the paper, and then in phase number 2 we have developed a lot of good materials to train the medical field on how to do brush biopsy, as we have proven that it works for the Fanconi population. And also we have picked up a very important point. It means self-empowerment. And we have done a lot of materials, and we will kind of introduce you a little bit into that. But this is actually the topics of the last years, and so we can't tell you everything in detail, but if you ask us in the screening room, we will explain everything in detail. Phase number 3 we are in right now, and this is actually the cats. So this is really like the material we have developed, bring it into your hands, into your power, that you can support yourself besides the medicals. We have 4 topics today. Which preventive screening do I need? Why can oral health awareness save lives? How can oral self-checks be game-changing? And ways to power up my personal prevention program. So we will go through these program points today. Pressure. No, high five. You can do that. Okay. And this slide is something really important because it shows everything an adult has to do when he's adult. And even if he gets older, the more important it is. Because as we know, we lose our friends, our children, our persons, our loved ones due to cancers, in Fanconi mostly. And the main topic is oral cancer. And also it's very important to look for esophagus, and also for the girls, the vulvar region. And these are really the main topics. And this is a slide where we try to put everything together on one slide, because we found out in the past that it was some kind of confusing to find information. What should I do? How should I do this? How frequent should I do this? And so on. This is also available on our webpage, and also we have created materials which we will show you more in detail later too. I think for right now it's most important that you know Fanconi anemia, cancers are not a childhood topic, it's more an adulthood topic. We can concentrate on the most important things. So it's not a pan-cancer disease that you have to watch out all day long for everything, everywhere. So you can concentrate on oral cavity, on esophagus and vulvar region for the girls. This is important to know.
Okay, as Christina said, the project is approximately 20 years old now, and things have changed a lot since then. Yesterday we had a wonderful psychosocial discussion, and the question was, how can we improve our research when we integrate FA adults advocates? Last year's symposium, or adult treatment retreat, I showed a graph and I got some very nice feedback. And the feedback was that we presented you some average numbers of survival of FA patients. And therefore we did some homework, and we would like to give you some of our data. In our complete cohort, over the 20 years now, we have more than 1,000 Fanconi anemia individuals participating. More than 1,000. So this is really a robust number. And so what we say, what we observe is also statistically significant. So when we look at our data right now, 2025, things have changed completely compared to 20 years ago. Only 13% are below the age of 80. The rest is above the age of 80. Let's sink this in, this information. When we started, when I went to camp in 2006 for the very first time, and Andy Eichenfield brought with me his office, we saw only very few FA adults. It was the completely opposite. We saw maybe 10% of patients being above the age of 18. And now look at this. More than 1/3 are even above the age of 30. What does this mean? In the last 20 years, average age was increasing with chronological age, meaning that from the majority of patients that we have included in our study, the majority is still alive and has not died. So this is a really fantastic information. And we are Germans, we do not want to give false hope, but it's something that you as a community can applaud. Give yourself an applause. And we have a goal, so that we also will like to increase that number of patients above the age of 40 and 50. Let's do that, okay? I would not be a medical profession and a clinician scientist if we do not do a little experiment. So I would like to have your full attention right now. You hear now a noise, and please, without looking at any device, just with maybe closing your eyes, imagine what are you hearing. This was a little Krieg. How long have we listened to that noise? 30 seconds? 15? So it have been exactly 21 seconds. The 21 is very important for our lecture today. And with this little experiment, I would like to show you a little bit of the perception of ourselves about time. Sometimes time is just running away, but sometimes time is also very, very long. Sometimes I see patients in my office and I think, I have met them maybe a week ago. Why are they here again? But then it was like 6 months ago. Be very careful about time, because time is really crucial when we talk about cancer development. Last year we made a nice experiment. Do you remember that experiment? For those of you who have been here last year, we made this like little test if you can bring all this picture in the right order. For those of you who are new to the field or new to our lectures, I would like to explain you very shortly. Here you have the normal cell and here you have the invasive cancer. This is something that we do not want to talk about today. We do not talk about cancer today. We will talk about this in-between status. And last year we learned a lot about time and progression over time, and from here to here. Let's see what they have recognized, Christina. Another test. How long does it take from here to here? Eagle, you are not allowed to say this. You got just the update in Denmark. And any ideas? Yeah? 6 months? 3 months? Would that be ask that question? In the average population, from here to here, takes 15 years. And we are not talking about the average population, but for the Fanconi population, we have quite different approaches, because what we study and what has been studied in the past was when you see something, and we only studied the last phases. So when we started our project in 2006, we looked for genetic markers, and then we have been able to identify these very early stages. And even in Fanconi anemia, this process takes up to 80 years. In some patients, it even takes 15 years from the very first change to cancer. And it's about these very first changes that we want to talk about today. Because it's very difficult when you have already a severe dysplasia, a carcinoma in situ, because then it really can be days or weeks until this can turn into invasive cancer. This is really true. But what we are talking about now is, when we talk about prevention, we want to focus on these very early steps. So, and this is important because we have here the point of no return, where we have the feeling we, as patients and as physicians, have nothing in our hands to interrupt this progression. But when we are here, you see these little arrows that can bring these dysplasias back again to normal. This is something that we want to focus on. Today, we would like to focus on this arrow going back to the normal tissue.
You can maybe see, but that time plays a crucial role in this game, right? So it's not like days and not like weeks, it's really years. Why to wait to go to a doctor and look into the mouse till we see the cancer when it's cancer? We can do this more quickly and more often. Let's take a look at our optimum patient. Yeah, it's like a really good patient and really aware what he's doing. And he's also actually not the youngest patient, let's say something around 20, 25 and above. And our patient would go to the doctor like 3 times a year, and then he would add in oral self-examinations just to check back what's going on in the between time. When, let's say, you have an oral lesion somewhere and you can see this and you let it check once in a while. But sometimes when it gets more to the right-hand side, it can rush up. And then it's good that we have to have a self-examination. So documenting something, not only like looking into the mirror and thinking, oh, it looks somehow the same, but do an oral documentation of that via our app. Will help you to have the process under control. So this is the perfect patient. Of course, we could also manage a patient who is willing to go twice a year to a doctor and fill somehow the gaps like 2 or 3 times in between to do an oral self-examination. But if we tell you to do 2 times or 3 times in half a year, you would do 1 time. And we are telling you to do this monthly in the hope you do this 2 or 3 times. Time is the trick to use the challenge, not the challenge, the advantage of time, that we look on a regular basis, and not only look, but compare on a regular basis. So we have developed, as I said, in phase number 2, a lot of materials also for the medical teams, which we will not present today. And you can see at Fanconi DE, which is the German presence of our support group, so I'm in the lead of the German support group, and /iCare, you will find a lot of resources for you, like wonderful videos, explanation, a lexicon, and so on in different languages. So right now we have it in German, we have it in English, we have it in Brazil, we are just in the translation process of French, and we will start in Spanish in January, February. So, and also we have a PDF as an explanation how to do an oral self-examination, and of course we have wonderful videos, which is much easier to follow. And you have us, you can contact us any time to get advice, to get help. We can do online meetings, whatever you need, we are here for you, because we really want you to use the advantage of time. Our heartbeat of the project, it's our app, FAXM. Actually, when you have downloaded the app, everything comes with it. And also you can reach via the app all explanation materials which we have developed. The ones being at our meetings here, at the adult meeting, they have developed over the years a lot of knowledge about lesions and how to look at and why to do oral self-examination and so on.
So Christina, I had a dream before really getting retired. I want to have this app out. The app was also developed together with you guys. We had 9 people, 9 countries represented in the beta taste phase. The app really gives you power, because, as I just said, when I sit in my office and the patient is coming to me and I think, oh, I have seen the patient 1 week ago, I have a good memory. But time is sometimes doing a trick. If I see a lesion, sometimes, because I love my patients and I want the best for them, I always think the lesion looks better than before. But this is more my emotional status influencing my judgment. So it's really important to have numbers. And therefore, the app is also important for you physicians. So this is an example of a young man. He took a picture of this huge leukoplakia, and then he took a picture of that again, and here you see how the lesion looked like exactly 2 years later. And the good thing is you can directly compare. Nothing changed. So this is really powerful, because when you start oral self-examination and you see something, and the older ones who are really pro, like Eagle and others in the room, then they can tell you, when you start to look into your mouth, you might get also a little bit of anxious when you see something. And to tell you the truth, it's very likely that you see white spots. But as long as they don't change, they are not dangerous. But who can tell if they have changed if you do not document? So please, go to the app, and there's a wonderful function where you can annotate the same lesion to different dates. So when you go to the doctor, you do not need to look up where was my last picture. You just click on the lesion, and then all the pictures from the last documentations are in one drawer. So very easy to compare.
Just have to add something. So this person did not send in one picture in 2021 and the next one 2023. So there are several pictures in between, just to be sure. I just took the most important time there.
Okay, another example, and this is a very important example. This is a patient, and when we saw the patient, this was a very nasty lesion. There was a lot of going on there, really big infection. We took brush samples, of course, and it even showed the beginning of genetic changes. We also saw this chronic inflammation due to fungal infection. Patient was treated, and don't be scared. 1 year later, look at that. This is also a wonderful, wonderful example. And this gives you maybe as same hope and love for the future than me, to see what's the potential of preventive screening. Preventive screening does not mean to document, the shit over time. It means that you have really the power in your hands to have the right treatment at the right time and to document how the lesions are changing. Moreover, and this is the third example. This is a lesion everyone knew. The patient knew, the physician knew, we knew. So then 1 year later, hardly any change. And then 1 year later, huge change. But you know what happened? Because everyone was so used to that lesion. Everyone thought there's no change. But with this documentation, you easily could see there's something going on. So at that time, the brush showed something, lesion was treated, lesion was fine. But this is a powerful tool to convince your physician to get active. Really important. Don't rely on the judgment only of your physician. And I'm a physician, I can tell you the truth. We see so many patients and maybe we forget, maybe we want the best for you, and then we think it's the same. So please, use the power of documentation.
Yes, and now again, when you have the app and you use it, and then you will produce PDFs which you can share very easily. And these PDFs will contain the mouth map you have marked, it will contain the picture you have done, and the description you have done with that. And your name will be on there, the date will be on there, and it's very, very easy to compare it from time to time and to send it to your doctor, medical team, or to us. So you are really welcome to do that, and you can see there are a lot of advantages in that. This is just a sum up what we have done in the past. For this year, we have the topic small move and big effect, and so there's always a little active part in here, so please get up, all of you.
Have to practice in the plane.
The explanation will follow afterwards. For right now, we're just doing something. So get in front of your chair, please. In front of your chair, like I'm standing here. Okay. Just sit down shortly and get up again. Okay. So now let's do it in a different way. Go down 5 seconds and I will count. And when I count sit, you will sit. And then go and get up again. Okay? So 5, 4, 3, 2, 1, sit. Up. 5, 4, 3, 2, 1, sit. You said before up. 5, sit. 1, 2, 3, 4, 5, sit. Up. 1, 2, 3, 4, 5. Sit. Up. How? Where is it? 5. Another 5. 4, 5, sit. Up. What do you feel? A little bit challenging, right? Okay, this is number one for now. Number two, in the back of your chair like this, and get up on your heels like this, and down. Get up. 1, 2, 3, 4, 5, down, up. 4, 5, down, up. 1, 2, 3, 10, 4, 5, down, up.
Actually, what we just did is something very important also to keep your brain active. But in one of the last year we talked a lot about self-screening. Last year we talked a little bit about the biological background of the disease, and we want to recap on that a little bit later now. Today we will focus on lifestyle choices. You already did some very important lifestyle choices, and we will come to that later. Repair mechanisms of your body are important. I mean, like talking to you, you know, Fanconi anemia is a repair disorder, but actually what we have is the scale, the fine balance between defect, damage, and repair. So actually, if you have a problem with the repair, you should be careful about the damage. But it's not only about the repair, because there are many mechanisms in the body repair DNA damage. And Fanconi anemia are very special because they cannot repair this double-strand break. But you know, in the average life, in the daily routine, these defects are very seldom. The majority of the DNA damage that we accumulate during the day, hey, you guys, you can repair that. Did you know that? So this is a very important information. Not all the DNA damage that you get you can't repair. The majority of these defects you can repair, and we have to focus on the ones that you cannot repair. So how does repair in our system works, or the accumulation of damage? So for example, as I just said, UV light. So when we go out in the sun, we don't have the sunscreen and we stay too long and we get a sunburn. Then we get a little damage of only, you know, like there's a little damage, and you can repair that. That's really good. Other things, like even radiation, it's what we learned. It's the amount of radiation that you get. You also can repair some of this to a different extent. So this is a very important information. Other defects you cannot really repair so very well, like these replicative errors. And what we learned about cancer, we always say cancer is a disease of accumulation of DNA damage over time. So this is a very nice example. You have the normal cell, then you have the first damage that is not repaired, the second damage, the third damage, fourth. And indeed, in Fanconi anemia, you have to be a little bit more careful, because the first damage is already inborn. The first hit is that you have a defect, DNA damage, repair system. But you still need some more damage until you get the cancer. So there is still something that we have to, again, time is important also for you. This gives us the room for preventive strategies.
What can we do about this whole process? Of course, what we hear and what we can read in all the guidelines and so on, don't go to the sun, into the sun, don't drink, don't smoke, blah, 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 and don't do this, all these things. So avoid risk factors. And of course, today and also yesterday and probably tomorrow, it's about awareness and early detection, to find also ways to power up your personal program. And all this helps, but still you can do something to support your self-repair mechanism. So this is the third level of thing you can do something, right? So avoid risk factors, go to early detection programs, to your physicians, do oral self-examinations, but also there's something down here to support the repair mechanism.
Christina, how do I do that?
Yeah.
Biologically speaking, you have two opportunities. You have the direct effect and you have the indirect effect. How to support these mechanisms? Because I said only a minority of damage you can't repair. This also means that you have a lot of powerful repair mechanisms in your body, and if you booster them up, they can also repair other things that you may not be able to repair. So how to booster these up? Number one, a direct effect are lifestyle choices, and we talk about these lifestyle choices later. And the indirect effect is something that we talked about last year, is the immunocompetence. How potent is your immune system to fight against pre-cancer cells. And this immune competence, it's not something that you just have and that you cannot influence, but the immune competence is heavily also influenced by the lifestyle choices. Talking about lifestyle choices, what can you do beneficial? Do you have ideas?
Less processed foods.
Yes, healthy nutrition.
More fibers like popcorn.
Good sleep. This is really important to get rid of, damage during the day, reducing stress levels. Also, what we have learned is that the right amount of weight is important, because when you are overweight, this is a light chronic inflammation status for your body. So this is important. And physical activity, what we just did. So, and the same is also for the immune competence. How to power up the immune competence? Of course, vaccination. Yeah, very easy way to boost up immune competence. Vitamin D has a very important role in shaping the immune system. You can either go out in the sun for 10 minutes or so, or you just take a pill. So in the winter I take the pill, in the summertime I try to ride the bike and get some sun exposure, but you might be very careful about the sun, so better take the pill, check your levels. And, as Christine said, fibers are very important because they shape the gut microbiome, and we love popcorn. So popcorn is very rich in fiber. Of course, there's also the sugar in there.
The caramel that kills you.
And again, the physical activity.
Take your chair, take your arms like this. 5 seconds back and then 1 up, okay? So, 5, 4, 3, 2, 1, up. I didn't say up. 5, 4, 3, up. Okay. How does it feel? Step back from your chair and hold yourself good on the lean of your chair with both hands. 3, 2, 1, up. And stay stiff. 4, 3, 2, 1, up. And stay stiff. 5, 4, 3, 2, 1, up. Exercise directly supports your repair mechanism, and exercise also improves your immune system, which provides your repair mechanisms. So this is a big challenge we can use, physical activity. This is our, let's say so, wonder pill, magic pill. The 4 things that we just made, we haven't made this up. These are 4 exercise things that you can do, and actually what we just did is proven scientifically that this has an impact. So you already did something preventional today. Very good. It's mainly not about losing weight, sorry, but when you look at this graph, physical activity and something that we just did now, we always say, you have to include the physical activity in your daily routine. This is quite challenging, but what we just did, these 4 things, these can be really implemented in the daily routine. And when you have a very close look at this graph, you can see that quite a number of problems in Fanconi anemia can be influenced by physical activity. Fertility is increased. Did you know that? Of course, immune competence is boosted up. Also, stress levels are going down, and we have a direct effect on our microbiota. And something that we see in Fanconi anemia quite frequent is an impaired glucose metabolism, so that we cannot really work with the glucose, with the sugar that we eat. So this is very powerful, and what we just did really helps you already. Let's get a little bit more deeper into it. The trick about it, about exercise, is that we use our muscles, and it's now actually not so an old scientific knowledge that our muscles are an endocrine organ. And it works really in combination with everything we're having. So we used to think we have kind of muscles to hold our system, that we don't fall down, or to have some kind of power to push or do something. This is also the truth. But the main truth is also that it's really an endocrine origin. There's something which is called myokines, and they have found only like 900 myokines till now, and they have even more. They know there must be more, and each myokine has a certain function in your body and in your whole metabolism, right? So it's really, really powerful. And we would not be on stage telling you this if we were not convinced that this is a really powerful, magical thing we can do. Everyone, but especially, of course, also the Fanconi population.
What we learned from the research in the general population, in the general cancer population, that individuals who really made something that we just did, moderate intensity training, have a 20% reduction of risk in cancer. So this is something. And this even goes for predisposition cancer syndromes like the BRCA1 or BRCA2 carriers. So this even works for you. Reducing your risk by 20%, this is really a lot. And it is also important, if you already had the cancer, that you live better and longer when you do physical activity. And there was one very cool study in the States where they used breast cancer stage 1 patients, and they found out that physical activity is more effective than chemotherapy to prevent relapse and longevity, so living longer. So this is really, really powerful.
How could I implement this in my daily life? So either you're a person who does exercise anyway, so maybe you have learned a little bit more today, but maybe you're like a couch potato like I was all these years. I mean, of course I was cycling, but yes, I was. It's really important, yeah? So let's talk about the amount. And of course there are papers like you could read and read and read how many to do of what and things like that. So a bit is better than nothing. So there are papers, of course, which tell you to do so and so many minutes a day or something like that. But also very low amounts have a big effect. Of course, more is better, but at least a little bit. And what we have done right now, these 4 exercises will take you 5 minutes to fulfill them. And even these 4 exercises are statistically really relevant on your health system and on your metabolism. The intensity, moderate, yeah? Also, of course you should challenge you a little bit. It's not enough to walk the dog, to be honest. It will not work out, because it's not like an exercise, it's just moving. It's not an exercise to walk with a dog. But when you move a little bit and get like a moderate, kind of a little bit of a sweating, at least that, then something will happen in your body. And of course, have fun. The 21 minutes, so come back to that number. This is indeed this one number which people tell you to do. So when you go to your physician or you read up in the newspapers or things like that, they will tell you, do a minimum of 150 minutes a week. You will read that everywhere, all over the world, the same number. And when you break it down on a daily basis, it will be 21 minutes. But, as I said, just recently I got into deeper knowledge about exercising. You could do this time, these 21 minutes a day. You could put them on the weekend as a weekend warrior and then go to the gym, do everything you do, like 2 or 3 hours, and just be, you know, like this. But you can also be the balanced beast, like do every day a little bit of something. But this is also interesting, the snack lover is also a type of exercise you can do, which is really proven by studies that is also working out. And what does it mean, snacking? Snacking could be something what we have just done, like these 4 exercises, like only 5 minutes a day. In this study, which I've shown you now, the exercises, of course, the one you should do on the wall, yeah, not on the chair, on the wall. It is really proven when you do these 4 exercises, and you don't even have to put them in the row in 5 minutes, you can spread them out over the day, you will have an effect on that. So if you're interested, we can give you more knowledge about this study, but I think this is so easy. And more impressive even is that when you exercise, also your depression and your mood will get way, way better. Also, this is the statistics. Okay, so did you have enough of exercise yet?
So we always offer you something special. This was quite special enough, but we want to do something more. The team, please come on stage. So in my former life, I was a musician. And Christina said, Eunike, we really should do a song. So, yes, we did a song just for you. And the song is, guess, 2 minutes and 10 seconds.
It just so happens there's a great app for that. It's free to download.